name is David Rubin. I'm a gastroenterologist at the University of Chicago, and I'm also a professor of medicine, and I lead the section of gastroenterology, hepatology, and nutrition at the University of Chicago. I've devoted my career to advancing the way we take care of people who live with inflammatory bowel disease. If I were to take away all the other things that I do, I would always still come back to being a doctor and taking care of people. That's my core identity. My goal is to make sure we find cures for inflammatory bowel disease. And I recognize how complicated that is. First of all, you heard me say cures, plural, because there is not going to be a single cure. These are multiple different conditions. In the space of inflammatory bowel disease, there's been an explosion of discoveries on the basic science side of things, as well as in the clinical treatment side of things. One of the biggest challenges we have is making sure that as that pace accelerates, it's meaningful, it's directed, and that it's getting back to the patients who need it. And so the way the Crohn's and Colitis Foundation does this very well, and the reason I've devoted so much of my professional life to serving the foundation is because they are the only organization that includes professionals and patients together to try to address the needs of the people who live with these conditions. On a big level, what the foundation has provided has been structure and an overarching focus on where we're trying to go as a field, because we know that we can achieve much more if we work together. For me individually, it has provided me with the resources and access to the individuals and the expertise for anything that I want to try to get to for our patients. In the last couple years that I've been working with the foundation, I've been extremely happy that they've started to focus on a variety of areas that were underrepresented in our science and in our understanding in the past. This includes focusing on pain management, understanding the mental health aspects of living with inflammatory bowel disease. The main theme of what we're trying to do is to make sure that we're advancing the science of IBD research and moving towards our cures, and also very much within the understanding of how to get care and education and science delivered to the greatest number of people, expanding our diversity, bringing in more women, bringing in more people who are otherwise underrepresented in medicine, and making sure we understand what their perspectives are and giving them opportunities to contribute in a meaningful way. I think that every patient who has Crohn's disease and ulcerative colitis, and frankly everyone who has a family member with Crohn's disease or ulcerative colitis, should be a member of the foundation. I think that when people belong to a community of individuals who share something, knowing that other people have these conditions and seeing what they're doing despite that or because of it is very motivational. And so I encourage people to be part of this community. It's not always about a support group where people are in a room together talking. It's about the larger idea that there are many people who have a shared experience and that together we can do a lot more. The way the foundation is successful is because all of you out there are contributing in different ways, by being members, by helping us raise money that is very much needed to continue the efforts that we have, and then by donating your time and energies to help us achieve our missions. It's only by working together across all of these different areas that we're going to be able to get where we're trying to go.